Kristin Ferguson. I'm going to be doing a basic IV insertion today. I have an order from my physician for normal IV fluids for an INT. So I see that my patient has no history of allergies and all of their lab came back normal today. So I'm just going to go ahead and gather all my items. I have a tourniquet. I'm going to use a Tegaderm. I've got 2 alcohol prep pads, my tape, saline solution. This is my INT tubing, my insertion needle and catheter, pen, syringe, and a blunt tip needle and gloves. Before I go into my patient's room, I'm going to go ahead and pre-fill my syringe. And I'm going to use 6 ml of normal saline. Here we go. Okay. All right, now that I've done that, I'm going to go ahead and go into my patient's room. So, hi, Mr. Smith. My name is Kristin. I'm going to be giving you an IV this morning. The doctor wants to give you some just normal IV fluids. Can you verify your name and date of birth with me? Okay, he verified everything well. And do you have any allergies? No allergies. Good. Can you tell me, are you right or left-handed this morning? Okay, he's left-handed, so I'm going to use the right arm. Before I get started, I'm going to go ahead and wash my hands here and apply my gloves. And I'm going to go ahead and take a look at your arm now. I see that you've got a good, soft, bouncy vein here that's actually big enough for what I need to do. Do you have any pain here? No? No pain. Okay. So I'm using the non-dominant arm. It's a large enough vein, soft and bouncy, and there's no pain there. I'm going to go ahead and apply my, well, no, you know what, I'm going to get ready to apply my tourniquet. Let's leave it there. Let me set everything up. I'm just going to prime my tubing. Okay, there's no air bubbles in my line. I have that ready. And like this, let me get my Tegaderm out. And I'm going to go ahead and time and date it now. Today is 9/1. It is 09/10. My initials are KF, and I'm going to use a 22 gauge. So I have that ready. Oops. I have my tape. Very good. Alcohol. Okay, now I'm going to go ahead and apply my tourniquet 4 to 6 inches above my insertion site. Just a little tight, Mr. Smith. Okay, I'm going to clean the area in an outward motion from the inside out. Okay, and I'm going to allow that to air dry while I get my needle ready. It's dry enough now, so I'm going to go ahead and anchor the vein down. I'm going to insert at a 15-degree angle. Very good. And I have a flashback, so I'm going to drop my needle down, insert my catheter the rest of the way, anchor that, and release my tourniquet. All right, I'm going to go ahead and check for blood return. That good blood return, and I'm going to flush with 3 mLs. Flushes very well. I'm going to go ahead and apply my tourniquet. Not my tourniquet, my Tegaderm. Very good. Take my tape and chevron. Good, and secure my INT tubing to the Tegaderm. Are you having any pain, Mr. Smith? Very good. Let's get rid of my trash. My sharps are going to go in the sharp bin. Get rid of all my garbage. I'm going to remove my gloves because I already had them on. And since you're not having any pain, I'm going to give you your call bell, and I'll be back to check on you in an hour, but call me if you have any pain at all, okay? At this time, I would leave my room. I would go ahead to the chart and document that today is 9/1. I inserted at 09:10 on the first attempt a 22 gauge INT. My patient tolerated that well, and there's no pain, no leaking, and no swelling. All right, hi, this is Kristin again. I got an IV order from the doctor to infuse 500 ml through the patient's INT over 2 hours, so I'm going to go ahead and get everything ready. I'm looking at my MAR and I see the order for 500 ml normal saline through the INT over 1 hour. Looking back in the patient's labs, I don't see any abnormalities, and according to the chart, the patient has no allergies. I'm going to go ahead and label my bag. I have 500 ml normal saline. Patient is John Jones. Today is 9/1/2014, and it is 11:35, and my initials KF. I'm going to put this here, and I'm also going to go ahead and get my tubing out. Maybe. Open all this. I'm going to go ahead and connect my tubing to my bag. Okay, and I'm going to let that hang on my pump. And I'm going to label my tubing 9/1 11:35 KF. Here, and while I'm here, I'm going to go ahead and also prime my tubing. All right, tubing is primed. I'm going to hang this here. And before I go into my patient's room, I'm going to go ahead and draw up a saline flush using a blunt tip needle. I'm going to do
It bit. I thought you could see that. I was gonna keep going, but I was like, oh my God, you can see it.
Got my flush ready, and I'm going to enter my patient's room. All right, hi Mr. Jones, it's Kristin again. I'm going to go ahead and start just some normal saline that the doctor ordered for you, just to kind of keep you hydrated. We're going to do 500 milliliters over the next hour at that rate, and with a drop factor of 10, we're going to do 83 drops per minute. So I'm going to go ahead and wash my hands. Can you tell me your name and date of birth?
John Jones, 1984.
Okay, and do you have any allergies?
No.
Okay, wonderful. How's your IV feeling?
Feels great.
Okay. Let me take a look at it. Put my glove on. By inspecting it, I don't see any redness or swelling. It looks great. You don't have any pain when I touch it?
No.
Okay, good. I'm going to go ahead and just flush, make sure that we got everything okay. Okay, good blood return. And using the push stop method, it flushes nicely. Very good. I'm going to reclamp this, disconnect my syringe. All right, I'm going to go ahead and get my tubing ready to connect. Clean this. Clean this. And connect. And I'm just going to set my drop rate factor. Again, that was 83 drops per minute. Okay, and I'm going to count that out. And I would count this for a full minute, and it comes out to 83 drops, so that everything looks good. Are you feeling any pain as it infuses? No? No? Looks good. I'm going to give you your call bell. Just call me if you do have any pain or anything like that. Otherwise, I'll be back in an hour to check on you. I would remove my gloves and clean up my mess. I would exit my patient's room and document that it was 11:35. I started 500 mLs of normal saline through my patient's right arm INT to infuse over the next hour at 83 drops per minute. Patient tolerated well and the IV site was in good condition. Okay, it's been an hour now since I have my normal saline, and I've got a new order to hang 1 gram of Vanco and piggyback that to the normal saline. So I'm going to go ahead and take a look at my MAR. I see that the physician has ordered 1 gram of vancomycin to be infused over 1 hour every 6 hours. Looking at this, which is in date, it's available 500 milligrams per milliliter. So for 1 gram, which is 1,000 milliliters, I'm going to infuse 2 milliliters. I don't know why I struggled with that. I'm going to go ahead and draw that up now while I get this stuff ready.
1,000 milligrams. I would get 2 milliliters. So I would go ahead and wash my hands and put gloves on. And I'm going to get a draw of 2 milliliters of vancomycin and add it to my 50 milliliter mini bag. And then because I'm leaving this over 1 hour, and I have a drop factor.
Okay, 2 milliliters. There. All right. And I know that vancomycin is a bactericidal medicine. It works by binding to the cell wall and fighting severe systemic infection. Adverse side effects are red man syndrome, so flushing of the face, GI distress, nephrotoxicity, ototoxicity. It's contraindicated in patients who take aminoglycosides, diuretics, aspirin, and anybody who's obviously allergic to vancomycin. It is okay for patients who have penicillin allergies to take Vanco. My nursing interventions, I would monitor my patient for the cranial nerve 8, so a whisper test. I'd watch their renal function, so their bun and creatinine, and I would assess for symptoms of the red man syndrome. I'm going to go ahead and put the Vanco that I drew up in the 50 ml piggyback bag.
You were doing it.
So I'm going to clean my bag. I struggle with that. There it goes. All right, and that's 2 mLs in there. Out of the way. And I'm going to label my bag with my patient's name, John Jones, 1 gram of Vanco. The date is 9/2/14. The time is 15:45, and my initials KF on the bag. And I'm also going to go ahead and get my tubing ready. All right, so I've got my secondary tubing. All that there. I'm going to spike my bag. Ooh. Take your time. Which it's now primed. Still. Okay. And hang that there. Okay. At this point in time, I'm going to go ahead and go into my patient's room, labeling my tubing with the date, time, and my initials. There we go. All right, gonna go into my patient's room now. Hi, Mr. Jones, it's Kristin again. It's been an hour since we hung that normal saline. How are you doing? Good, good. I'm washing my hands, and I'm gonna go ahead and put on my gloves now. The doctor went ahead and ordered some vancomycin for you. Are you familiar with that?
No.
Okay, it's an antibiotic. We're gonna give it to you for your infection. Your lab showed that your white blood cells were elevated, and also I would have done a CNS if this was the first time that I had hung the vancomycin, but it's not. All right, I'm going to go ahead and get this ready. How's your IV site feeling?
Good.
Good. Okay. Let's see here. Before I do anything, I'm going to drop this bag down. Okay. I'm going to slow this. And I'm going to go ahead and piggyback my line. Now, since he ordered it to be given over 1 hour, and we're doing a 50 ml bag with a drop rate of 10, that gives me 8 drops per minute of the Vanco. So I'm going to go ahead and manually count that out now. Okay, I've got that going at 8 drops per minute. My primary is slowed down, and as far as I can see, this looks good. Are you having any pain? No? Okay, I'm going to go ahead and give you back your call bell. I'll be back to check on you in an hour when this finishes, and at this point I would clean up my mess, sharps in the sharps container, wash my hands, and I would go to document that I piggybacked 1 gram of vancomycin with the normal saline that's going into the right arm INT. I did it on 9/2 at 15:45, and the patient tolerated everything well. Ready? Okay. It's been an hour now since I hung my Vanco, so I'm going to go ahead and take that back down and just restart my normal saline. I'm going to go in. Mr. Jones, how you feeling?
Feeling good.
Good. Okay. I'm going to wash my hands, put on my gloves. I'm just going to stop your vancomycin, and we're going to restart your normal saline at the same rate that it was at before. So I'm going to clamp this off. Disconnect. I have an alligator clamp right here. That works. And then I'm going to wipe this off. Very good. And I'm going to reset my 83 drops per minute that my saline was ordered to go at before. Okay. And 83 drops per minute. Very good. Okay, everything still looks all right. You don't have any pain? Okay, I would give my patient back his call bell, take off my gloves, wash up, and go document that he tolerated the vancomycin good, IV site is still in good condition, and normal saline has been restarted at its normal rate, 83 drops per minute. Okay. This is Kristin Ferguson again. I now have a new order for my patient to insert a NG tube for suction, low intermittent suction, to take some stomach secretions out. I'm going to first gather all my supplies. So I have a towel, gloves, pen light, stethoscope. I have my 12 French NG tubing. I have a piston suction, rubber band. I have a safety pin and lubricant jelly, tape, and a cup of drinking water for my patient. I'm going to go ahead and go in. Hi, Mr. Jones. How are you feeling? Good. I'm going to go ahead and just take a look at your armband here. Verify that it's you. All right. Can you tell me your name and date of birth?
Bob Jones,
Very good. And your date of birth?
1981.
Okay. Do you have any allergies, Mr. Jones?
No.
Okay. I'm going to wash my hands over here and put on my gloves. So the doctor ordered you to have an NG tube. Have you ever had one of those before?
No.
Okay, what it is tubing that goes in through your nose and down to your stomach, and I'm going to connect it to a suction canister, and it's going to be removing some excess bile from your stomach to kind of help make you feel better, okay?
Okay.
All right, so the first thing that we're going to do is take a look here. I'm going to check your nose. All right, and open your mouth, say ah.
Ah.
All right, very good. I'm going to use the left nair to insert the tube, and I'm going to go ahead and measure first. So what I'm going to do is actually hold this up against your nose first, okay?
Okay.
We're going to start here. It's going to wrap down around your ear and go all the way down to the xiphoid process right here. And that is 55 centimeters. So I would take off a piece of tape and wrap it here, and that holds my measurement, okay? I wouldn't drop my tubing like that. All right. I'm going to get my piston section ready. We're just going to put a little towel here across your chest. You feeling okay still?
Yeah.
Good. I'm going to tear open my lubricant and do about 4 inches of the tubing through that. I'm just going to leave it right here for a moment. I have 2 pieces of tape pre-torn so that I'm ready, and a cup of drinking water here. All right, we're gonna go ahead and get started. I've got my lubed tube. I'm gonna go ahead and insert the tube now, just a little bit, a little uncomfortable. There we go, good. And I feel some resistance, so I'm gonna go ahead and ask the patient to lean their head forward, and we'll get the cup of drinking water. And every time you take a sip of water, I'm gonna advance the tube, okay? There we go. All right. Okay, all right, there we go. And I see that we're at our 55 centimeter mark, so we can get rid of the cup of water. How are you feeling?
Okay.
Okay, you can talk, that's good. Let me check the back of your mouth. I don't see any coiling. No coiling back there in your nose. Good. I still have to check for placement. I'm going to put a little piece of tape just to keep our spot, oops, on the tubing. There we go. Still doing okay?
Yeah.
All right. So, first of all, I'm going to draw back on this syringe. All right, I've got about 20 ml of a yellow-green vial, so that tells me good indication that we're in the right place, but I'm also going to take a listen and make sure, okay? All right, hold this here. I'm going to return the aspirin to the patient. Good. And I hear a bubbling, gurgling sound, so that's another good indicator that we're in the right place. I could also use a pH paper and make sure that the pH matches what it should be for the stomach. All right, so let's move this towel out of the way. I'm going to take our second piece of tape and anchor down. Very good. Take a rubber band. Now you're going to be able to move, just kind of be cautious. You don't want to pull this out. I'm going to anchor it to your gown so that you still have good range of motion. There we go with the slip knot, that's good. And I'm going to connect this to low intermittent suction. All right, so some good things to remember that you need to call me if you want to get up. I can help you come down and disconnect and get up to go to the bathroom. I have your call bell here. Are you having any pain or anything like that?
No.
Doing good. And I see that we've already got 50 ml out of green yellow vial, so that looks good too. It's working well. I'll be back to check on you shortly, okay? I'll go ahead and take off my gloves, wash my hands. Oh, and I'll be back to do your oral care every 2 to 3 hours, okay?
Okay.
Good. All right. So I would go to my patient's chart and document that I inserted a 12 French NG tube to low intermittent suction through the left nair. Patient tolerated the procedure well, and I've already gotten 50 ml of a yellow-green vial secretion. Okay, it's been about, well, I'm on my next shift now that my patient has had the NG tube, so I'm going to go in and irrigate, make sure that everything is functioning okay. Hi, Mr. Jones, how are you feeling?
Good.
Good. I'm back again with you today. I'm just going to irrigate that NG tube that we put in yesterday, make sure that everything's functioning all right, okay?
Okay.
All right, let me wash my hands. Very good. I'm going to put on some gloves, and we're just going to do some basic stuff first before we get started. Okay, let me take a look at your armband. Name and date of birth.
Mr. Jones, 1981.
Okay, any allergies? No? Good.
No.
Very good. First thing I'm going to do actually is pause your suction here, and I'm going to disconnect. Let me get this towel across you. How'd you do with the NG tube last night, okay?
Okay.
Good. All right, I'm going to disconnect this. And actually, let me pull these covers down so I can listen to you. There we go. I'm going to, okay, got about 30 ml just of air. I'm going to connect my piston syringe. And I'm just going to listen, okay? I've got you sitting up nice and tall. All right, here we go. And I hear a swirling, swishing noise. That's a good indication that our tube has done all right through the night. I'm going to go ahead and disconnect this, and I'm going to irrigate your tube, okay?
Okay.
Alright, this in here. I'm going to draw 30 ml of normal saline. I'm going to insert this, okay? You let me know if you have any discomfort. Nice and slow. Alright, we've got all 30 ml in. You're still doing okay?
Yeah.
Good. I'm going to go ahead and pull some of that back out. Alright. And I got a 35 milliliter return, so a 5 ml difference. I'm going to go ahead and discard this. I'm not going to reinsert into the patient. And I'm going to reconnect you to suction since everything's doing okay, alright? Connect this. I'm going to turn it back on to low intermittent suction and cover you back up. This is still intact. That's good. And I see we've got another 50 ml out through the night, so that's great. I have your call bell here. Just remember not to get up without me, and I'll be back to check on you and give you some oral care in about 2 hours, okay?
Okay.
All right, I'm going to take off my gloves, wash my hands. I would exit the room and chart that patient tolerated the procedure well. I was able to auscultate. The NG placement was good. I only got a 5 milliliter difference back in what I irrigated with. It was the yellow-green vial, just like yesterday. No indication that anything is complicated, and I reconnected it to the low intermittent suction.